So actually being at AES this year reminded me of the opportunity that I had to interact with Brandy. Brandy and I met through Cynthia Harden, a mutual friend. And one of the things that I did after meeting Brandy was I wanted to learn more about My Epilepsy Story. And the more that I learned, I picked up on the passion that Brandy has for this organization, certainly the passion that she has for caring with women and girls with epilepsy. And I really think that it's important to take that passion, and I wanted to be part of it because she was doing a lot of great things for women and girls with epilepsy. So my interest in women's health dates back many years. Certainly as I see patients in our clinic, half of those are women, and so as a pharmacist I'm very interested in lots of women's issues in epilepsy. Drug interactions with oral contraceptives, bone health, folic acid supplementation, pregnancy, all those kinds of things. So there's lots that a pharmacist can do for a patient with epilepsy, especially a woman with epilepsy. So it's really important for all patients to take their medicines. I think it's especially key for women with epilepsy. I mean, we talk about, when we interview a woman of childbearing potential, we talk about folic acid supplementation and making sure that our patients understand what the risks are and benefits are from taking their meds, especially during pregnancy. There's lots of information to share. We can ask questions and learn from our patients about maybe what side effects they're having and what barriers may be preventing them from taking their medications. So there's all kinds of barriers: side effects, cost, acquisition, concern, fear, and really having frank and open discussions with our patients, sometimes difficult conversations. But I want to add here that I think it's really important that women should come to their appointments with questions. Even on the MES website, there's information about things that patients should bring to the questions that they should have come to their appointments. Because for us as providers, we want to make sure that we are working with an engaged patient. So a woman should come with questions, a woman should come with concerns, and then we have very frank and open conversations regarding risks, benefits. It's really important to take meds. They're anti-epileptic drugs for a number of reasons. We know that adherence can decrease seizures. We know that adherence is associated with increased quality of life. We know that good adherence is also associated with an increased mood, or better mood, less depressed. We know that there's less cost to the patient and to the system as far as patients that are adherent can decrease what we call morbidity and mortality, so can decrease the adverse effects of having seizures. So it's really important to engage that patient. One of my colleagues once told me, "Jim, we're in the advice business." So in the advice business, we recommend patients take their meds. We come up with a care plan in collaboration with the patient, and really so that that patient is engaged, make sure that they're part of the decision making. So I think it's really important to identify that pharmacists are accessible to patients, to women with epilepsy. They can go to their Walgreens, their Kroger, their Giant Eagle, their community pharmacy, engage in conversations with the pharmacist, questions that they have, questions about drug interactions, questions about why I need to be on folic acid. And the important thing is that that pharmacist is accessible, that pharmacist has been trained to be the drug expert. So really I'm an advocate for making sure that patients utilize their resources, including their community pharmacists.